Okay runners, welcome back to Treatment Thursday. Like we talked about on Monday, this video is going to be especially interesting for you because we're talking about the posterior tibialis, which is the muscle that is often involved in medial tibial stress syndrome, also known as shin splints. The first one is actually doming of the foot. So essentially what you're doing with that one, it's really hard for me to show, but I can kind of explain it. So for doming with the foot, you're gonna make sure that you have your heel firmly planted on the ground as well as the ball of your foot and the outside of your foot. They call that like the tripod of your foot. And then you're just gonna work on contracting the muscles in your lower leg to try to get that medial arch rising or domed up. It's gonna take a little bit of work and it's gonna feel a little funny to start, but we're really just working on activating that posterior tib with this exercise. The next exercise you're gonna need a band for. We'll say it's my right leg that's my issue. So you put the band around your foot on your right leg. You're gonna just step on that band with your other foot and then bring that foot up across your leg like this. Then what you're gonna do is you're gonna work on pointing that toe and bringing it in toward the inside. So like we talked about, plantar flexion and inversion, that's the action of this muscle. You shouldn't feel a lot of stress through your toes with this, but you should feel a good pull kind of through here along that track of that muscle that we talked about. That's a really good way to start strengthening this muscle. And then I'll often give people just some calf stretches to do when they're struggling with this as well. So really good way to do that is just right up against a wall, toes up, heel down, and you're just leaning in. We've talked about this one before on our channel here. You can also find a stair step to stand on and then drop your heel off. Those are your Treatment Thursdays exercises for the posterior tib. We'll see you next Monday.